Hi, this is Dr. Doreste with the Cranial Release Technique, back with another video. Today I wanted to speak about exercise and what about the Cranial Release Technique enhancing your ability to exercise, hopefully reducing injuries and giving you a better workout. If you're watching this on YouTube, if you'd be so kind as to subscribe. I'm also on Rumble at CRTDOC, that's my channel. CRT for the Cranial Release Technique and DOC, DOC. So CRT, DOC. Great. So exercise. We know it's important. It's something we should do on a regular basis. Everybody likes to do something different. Some people lift weights. Some people run. Some people do yoga, martial arts, whatever it is that you're into. The purpose of the exercise is to help your body function better, stronger, more flexibility, better balance, calmer mind, depending what type of the arts that you're into, what forms of exercise you do. And of course, the problem is with some types of exercise, and it happens with everybody, we get injured. Runners know about the leg and the knee and the ankle. Martial artists, could be a shoulder or back. Weightlifting, whatever type of exercise you do tends to lead towards problems. And that's really why I wanted to create this video. Remember, everyone's cranium is probably somewhat distorted. And what I mean by distorted is those 22 bones are actually out of alignment. And you can tell that by looking in the mirror or looking at your husband or your wife or your children or mom and dad and looking at the eyes and seeing if one eye looks lower than the other, if one eye looks smaller than the other, right versus left, if one of the cheeks appeared to be lower than the other, if one of the ears appeared to be lower than the other, or rotated forward or backwards. That's a simple way to determine that the cranium is in fact out of alignment. And if it's hard for you to look at yourself, you could take a selfie and look at that picture, and you'll probably see these distortions that I'm talking about. When those cranial bones shift and misalign, that negatively impacts the alignment of the spine, the alignment of the pelvis. So now you are more susceptible to injury. Running, stretching, yoga, martial arts, weightlifting, boxing, whatever it is that you happen to be into. And so when those cranial bones shift and the spine accommodates for that, and the spine has to shift because of that, that's the first of the problems. The second problem is the tendency is we tend to find through different technological analysis that one brain hemisphere, right versus left, tends to be out of balance. One hemisphere is overactive, one hemisphere is underactive. That will also affect the alignment of the body. That will also affect your ability to become injured because of imbalances within the muscles, the tendons, the ligaments, the actual structure. In addition to that, when the cranial bones have shifted and misaligned, and the brain is out of balance, now the autonomic nervous system is out of balance. And what I mean by that is you've probably heard of the fight or flight mechanism. That's the sympathetic nervous system. That's part of the autonomic nervous system, the involuntary system that happens whether you're aware of it or not. So sympathetic is fight or flight. Parasympathetic is a sort of relax, rest, heal, regenerate side. And you need both. So while you're working out, you're probably in the sympathetic phase. You're in the fight or flight. And then after you come home and sit down and reflect on your workout, you should be shifting back into the parasympathetic, the healing and repairing, the rebuilding of new muscle, new tissue, new organs, new blood, breathing calmer. You're not in the fight or flight anymore. The problem is the tendency in the world today is that when these bones have shifted, when the autonomic nervous system is out of balance, the tendency is, let me flip those lights on because it was sunny here a few minutes ago in New York. Now it's getting a little cloudy. They're expecting rain. So as the brain shifts, the tendency is you get stuck in the fight or flight mechanism. So now it's time for the workout. You did your workout. You came home. You're sitting quiet, but you're still revved. And you can't really calm down. That's because you're still stuck in the sympathetic nervous system. So the cranial release technique, the one purpose of the cranial release technique is to, and the solution to all of these sporting injuries and the tendency to weaken the body to become injured, which we don't want, we want to avoid that, is the cranial release technique. This 1 minute cranial-based technique that opens, aligns, balances the cranium, balances the spine, balances the brain, balances the sympathetic, the parasympathetic, and the sympathetic nervous system. So that when you come home, sit on the couch, relax, everything starts to calm back down, and you can go into heal and repair, which is where you want to go after the exercise. Okay? So, Cranialrelease.com is the website. You might want to search. As a practitioner in your area, you can go and visit them, get on the table. Regardless of whether you have symptoms or not, you can be evaluated to see if the practitioner feels that you would benefit from the cranial release technique, which in my opinion, virtually everyone benefits. There's really no reason why you shouldn't experience the cranial release. So that's the website. If you're a practitioner or you know a practitioner out there that thinks maybe this is something they would like to add into their practice, you can go to cranialrelease.com. You can click on the online training program and take a look at that. So we put all this on an online platform so you can learn as a practitioner. How do you learn all aspects of the cranial release technique in the comfort of your home or office? It's all at cranialrelease.com. This is Dr. Doreste with the Cranial Release Technique saying over and out. Adios, my friends. I hope to see you down the road. You be well. Cranialrelease.com. Thank you.